Grab a coffee and let's talk about the no jab, no job policy and who's actually losing their jobs. So when the pandemic first came around and the vaccine arrived and we thought that was going to be a solution for many people, we were always told that you would take the vaccine, but we would respect the views of those who didn't want to take the vaccine and that you wouldn't be penalised for that choice. That was what we were told. The vaccine would be effective. We would encourage people. We would try and get the percentage as high as possible. But at the same time, we wouldn't force it on anybody or on any group. And that was the promise that was given to us. In fact, just before the election, we were told those exact words.
You in this country have sanctions against people who don't take or aren't vaccinated against COVID.
No, we haven't done that because actually when you look at the levels of vaccination we managed to reach in New Zealand, they are high. People talk about anti-vaxxers. It's actually the bigger issue in New Zealand is more of what Dr. Bloomfield calls vaccination hesitancy. It's not people who are strongly morally opposed. It's more people who just need a bit of extra support, remove the barriers, a bit more information.
But no penalties if you don't.
I see no reason to do that. We get up well over 90% for our vaccinations without that, and I believe we will for this.
Nice.
So that seemed like a pretty fair middle ground, wasn't it? We would encourage vaccinations, but at the same time we would allow for vaccine hesitancy and we'd also not force it on anybody. But of course, that all seemed to change and we had the mandates, but we were told they were just for the high risk sectors. They were for the education and the health sector, especially where they are working with vulnerable people. But it seems to have gone far further than that, to the point where the Prime Minister is now quite openly saying that, yes, there will be two groups in society. There will be the vaccinated and the unvaccinated. Have a listen.
So you basically said this is going to be like, well, it's almost like, you probably don't see it like this, the two different classes of people. If you're vaccinated or if you're unvaccinated, you have all these rights. If you are vaccinated...
That is what it is. So, yep.
Can you describe for people previously?
That is what it is. There will be two groups. But how far has the mandate actually extended? Well, we put out an email asking people to tell us about jobs they had lost because they hadn't been double jabbed. And it is quite wide ranging. We heard from people who have lost their jobs who are truck drivers, horse eventers, participants in cycling competitions, arborists working with trees, tennis coaches, scrapyard workers, administrators with no client contact, apprentice electricians, bus drivers, doctoral students, courier drivers, automotive painters, volunteer firefighters, structural architects, people who work on the roads, road maintainers, fitness instructors, aircraft engineers, gardeners, voluntary driving instructors, office administrators, nighttime security guards, business intelligence analysts, grounds maintenance workers, caretakers, part-time student farm workers who just want experience working with animals as a student, plumber, drainage and gas fitter apprentices, racing horse trainers, table tennis coaches, and we even had just before I started recording this, drain layers and fruit pickers. So that mandate has extended a whole lot further. Now, the problem with that is that the vaccine has been seen as part of the solution, but it's not the whole solution because as we're now starting to find out, the immunity starts to wane over time. In fact, I actually have an article here from Newsroom, which is a left-wing, government-friendly news website, and it actually admits that new studies confirm waning immunity over 6 months after the vaccination. There's still protection, but it says, questions have been raised about who should be considered fully protected when it comes to vaccine passes because studies are showing that the effectiveness of the vaccine decreases over time. Now, we would argue that the solution actually to allow for both those who conscientiously disagree with taking the vaccine, but also to test those who are vaccinated, is to do the rapid antigen testing. And so we have launched this petition, don'tdivideus.nz, which asks that simply that people have the option of having the rapid antigen testing. And that would not be just for people who have been, who don't want to be vaccinated, but it seems like possibly we should be rapid testing people who have been double vaccinated as well, because that gives the most up-to-date status of whether a person is carrying the COVID virus. And that seems like a pretty good solution. So, we would encourage you to sign the petition. Don'tDivideUs.nz. Let's find a middle ground that respects the choices of people, but also ensures that we have the greatest protection in society for both vaccinated and for the unvaccinated.